called it compassionate directness, which is all about empowering employees to give feedback and surface problems in real time. And I want you to know that that's what I want for our university. It's what Shana, you and I have talked about, and the importance, I think, of the employee forum. We want to be a place where our employees can speak and to know that their voices are heard, and that we can act on the feedback. And so again, I've been grateful for your honest feedback of the struggles of this past year. We have to take these lessons into 2021 and look at how we can enable that compassionate directness that I just shared with you. So as we go through the spring semester, my team and I need and value your feedback and want to continue to hear your feedback. We will announce any changes to our spring planning this week. As I mentioned back in early December, that if we were going to adjust our plans for the spring in any way, that we would do that no later than January the 9th. I recognize that's coming up here at the end of the week. We are concerned certainly about the numbers across the country, across North Carolina. While Orange County has had fairly stable numbers over the past month, we are beginning to see an uptick there. And so we're concerned about that. But I do feel confident in the work that we've done to prepare our campus for the spring semester. We've learned a lot from our experience in the fall and the experiences of other schools across the country. And we've made changes accordingly, and we're better positioned for success this semester. Just to mention a few of those, I mean, the robust asymptomatic testing program that we've put in place is a significant shift from where we were this fall. And that asymptomatic testing will be available for employees as well as our faculty and staff beginning on Monday, the 11th. There are two major ways in which we know that we can stop the spread of the virus, and that is to follow the 3 W's, which we've all become very aware of. And the second way is to isolate people who are sick, which is done through identifying them through testing and then getting them into to quarantining. So we're working hard on everything that we can control. With the vaccine, there's a light at the end of the tunnel, but we still have a long way to go. And I am in regular contact with our infectious disease and public health experts. We've had 3 or 4 meetings just over the past 2 days, and continuing to stay in touch with Orange County Health Department, as I've already mentioned. But we are planning for the most efficient distribution of that vaccine when it's available to us, and we will keep you apprised of progress that we're making there. We have some of the best experts in the country, as I've said repeatedly over these past 10 months. And you may have seen that they were recently ranked, UNC-Chapel Hill was recently ranked 11th globally by U.S. News and World Report for our infectious disease research and the way in which our public health experts help to disseminate that information and to help policymakers make decisions around the pandemic, such as COVID-19. So we will continue to consult with these experts, our public health experts, our social science experts, and the Orange County Health Department and North Carolina's Department of Health and Human Services. And so I'm grateful also for the work of so many other people on campus that we've brought to these conversations. Our, Provost Bob Blouin has led our roadmap implementation team, which has done incredible work over these past 10 months. Our Campus and Community Advisory Committee, which was formed back in September and really helped to guide our decision-making over the past 3 or 4 months. I want to thank you, Shana, for co-chairing that committee alongside Mimi Chapman and Reeves Mosley. And we'll continue this semester to ensure that more voices are included in the process of decision-making moving forward. And I am also excited about our new staff advisory committee to the Chancellor. We had our first meeting back in December. And as I said at that time, I will enjoy coming as often as I'm invited to the employee forum meetings. I view this new campus staff advisory committee as being one that will supplement the feedback that we get from the employee forum and giving me additional perspectives from our staff across our campus. And so I'm going to turn this over to Amy Locklear Hertel and Sibby Anderson-Thompkins to give you an update on our strategic plan, initiative number 1, Build Our Community Together, which I think you know is our first strategic initiative. And you know, as I've said, there are many things that I'm excited about and looking forward to in 2021, but one of them is the progress that we've made and will continue to make on this critical work around building our community together. And you are our employee forum is a major part of that. We've devoted significant time over the past year with our leadership team talking about how to make diversity, equity, and inclusion real at Carolina. The relatively new diversity council that Sibby created is determining additional ways in which we can change our structure on diversity, equity, and inclusion. We are continuing our work with the History, Race, and a Way Forward Commission, of which we have a number of our staff engaged in that commission's important work, and much more to come. But we're looking forward to other important events. Many of them will be virtual, but we have our MLK events later this month. And as I've said before, we can't be successful as the leading global public research university if we don't build a strong community where everyone feels and knows that they belong here. So I again just want to thank all of you, and I'm going to turn it over to Amy and Sibby. And after they speak, I'll welcome questions and additional thoughts that you might want to share with us. So thank you.
Great. Thank you so much, Chancellor. I appreciate your remarks this morning. I'm going to share my screen here, and then Sibby and I will do some introductions. I believe I have screen sharing capability here. Just a moment. Great. Well, I first of all want to just extend gratitude for being invited to share some information on Build Our Community Together, which is Strategic Initiative 1 to Carolina Next, with this important group of our employee forum. You all are critical to the community that we want to build at Carolina, and you're an important individuals helping us in that effort. And so we value your input, we value your partnership, and we hope that you'll find ways to engage with us and see ways that this work has unfolded over the last year. Just by a brief way of introduction, I'll ask Sibby to introduce herself as well. My name is Amy Locklear Hertel. I am the Chief of Staff to the Chancellor. I also have faculty appointment in the School of Social Work. My background is in community building, particularly with working with American Indian communities, and I previously served as director of the UNC American Indian Center on campus. As a student at Carolina many years ago, I had the great benefit of getting to know Dr. Sibby Anderson-Thompkins, who served as was a wonderful mentor for me as a student. And so it's just been a pleasure and quite an honor to be able to work alongside with her on Build Our Community Together. And Sibby, would you like to introduce yourself?
Yes, thanks, Amy, for aging me. But hi, everyone. I'm Sibby Anderson-Thompkins. I serve as the Special Advisor to the Chancellor and Provost for Equity and Inclusion, and I serve as the Interim Chief Diversity Officer. Like Amy, I hold a faculty appointment. I'm a professor of practice in public policy in the College of Arts and Sciences. I've had a long history here at UNC. I've served in roles with 3 divisions on campus, starting my career in student affairs, working with underrepresented populations, academic affairs as a dean who worked with really supporting students who were in academic jeopardy. And in the last 10 years has really focused on hiring and professional development and recruitment of the research workforce. And so, and leading the Carolina Postdoc for faculty diversity. So I'm excited to be part of this leadership team that I feel is truly committed to bringing about some real change. Thank you.
Thank you. So I just wanted to take a moment, Sibby and I thought it would be important for us to share with you all and remind us all the 3 objectives under Strategic Initiative 1, Build Our Community Together. And you can see them all listed here. We're investing in policies, systems, and infrastructure. And we're going to talk quite a bit in this presentation about the infrastructure we've been building that promote belonging, community, and transparency across this Carolina community. We are working to enhance the educational benefits of diversity, equity, and inclusion through our student retention, our recruitment, and our enrollment efforts. And then finally, in 1.3, we are highly prioritizing diversity, equity, inclusion in our teaching, our research and service, as well as in our hiring, our evaluation and retention, and promotion of faculty and staff. And so we're going to touch a little bit on all 3 of these, but we really want to focus on the infrastructure that we've been developing over the last year. Again, these are just straight commitment statements that, we are developing this infrastructure and we are committed. And I want to emphasize here, really committed to hiring and retention of our staff on campus. We thought it'd be helpful to sort of show you a year in review of where we've been with Strategic Initiative 1. This is not a year in review of all of the efforts of many people engaged in Strategic Initiative 1, but this is sort of a high level review of where we started the year with the leadership team and where we've ended or where we are currently. So back in January of last year, Carolina Next was launched. And at that time, Build Our Community Together was introduced to the campus community. It was endorsed by the Board of Trustees. And there was an identification of strategic leads to help us implement the opportunities and to assess the opportunities within Strategic Initiative 1. And so we extended about 12 to 15 invitations to some faculty and staff to join us on this effort, and they all accepted. In February, we were very happy to have Sibby join us on the leadership team as our special advisor and intern CDO. And shortly after that in March, she and I met with the Provost with our strategic leads for Strategic Initiative 1. And that's really where we started to talk about the implementation of this initiative. That happened to be the week before we went remote due to COVID. And so Building Community Together took on a whole other meaning. Really had to take new lens, and we had to think through what did that look like in this virtual environment. And so we invited our leads to come back and help us reconsider the strategic objectives, to think about how we might want to refresh those in the new environment. And we did make some changes, and the strategic objectives you just saw on the previous slide were a result of those changes that were made. At this time also, Sibby started to establish the Diversity, Equity, and Inclusion Council, which we'll talk briefly about in just a few minutes. That council was charged by the Chancellor and the Provost. And then shortly later in July, the Chancellor hosted a meeting of the Joint Council of his cabinet and the Provost Leadership Cabinet, which included all the deans, to really talk about to introduce the council and to underscore the importance of the Diversity, Equity, Inclusion Council, but to also charge senior leaders at on the campus to think about the strengths and weaknesses of our diversity, equity, inclusion efforts on campus, to think about ways that we should stand stronger against structural racism, and to understand how we might learn from each other, things that are going really well on campus and areas in which we have opportunity for partnership, improvement, and growth. So we started that conversation in July, and that really paired nicely with the racial equity training that the senior leadership took in that same month. In August, we continued the conversation, and senior leaders on campus started writing reports and collecting data within their units and schools related to the questions that the Chancellor posed. And all of in the backdrop while all of this is happening, we had the UNC system in September initiate a the first ever system-wide racial equity survey. And as part of that effort, they were hosting town halls across the system, but also UNC specific regarding where we are as a campus on diversity, equity, and inclusion efforts. We have UNC specific data we'll be happy to share with all of you as well. Starting in November, the DEI Council expanded. So we expanded from having council leaders that were representative of just schools to having council leaders that represented schools and that represented units on campus to really help us develop a strong infrastructure that touched every aspect of the university. And so we have a really strong and robust now DE&I Council. And then shortly thereafter, we've had the creation of some subgroups in the council. We can talk a little bit more about that. But just this month, to bring us full circle, we're really excited about the hiring of a Director of Education, Engagement, and Belonging in the Office of Diversity and Inclusion. And Sibby, would you like to say a word or two about our newest team member?
Yes. Thank you, Amy. This is really exciting because in a lot of ways, we've been talking about build our community together, the importance of a sense of belonging. And I think by creating this new position, it really does put in motion much of the aspirations of build our community together. So I want to have Chloe introduce herself briefly. Chloe Lipriani is joining us. This is actually her third day in this new role of Director for Education, Engagement, and Belonging. Chloe?
Hello, everyone. I was delighted when I found out the forum was happening this week. This is clearly an integral part of my orientation and onboarding. And I'm really delighted to actually be coming back to the Triangle area. I worked for nearly a decade at the university up the road that shall not be named, but in international student services and support and in service learning. And I'm just really so proud and honored and excited to be a part of this team and a part of this community, and to be here as a learner and learn more from all of you and the great work that the Employee Forum is engaged in. And yeah, thank you. So I'm here as a listener this morning.
Well, thank you, Chloe. Chloe really brings a lot of experience in coaching, served as a consultant to helping to lead and develop international and multicultural teams. So I think she's going to play a critical role in helping us think about ways to engage the entire campus around diversity, equity, and inclusion, but also help us build capacity when it comes to inclusive leadership and equity. Thank you, Chloe.
So welcome, Chloe. We're so happy to have you with us. So as you can see, we've had a busy year. We've been working through the year on really developing this infrastructure. And what we don't have listed here, and I hope we'll be invited back to the forum to share with you all the different initiatives that have been undertaken over this last year, the good work happening with the Commission on History, Race, and a Way Forward, and how that's unfolded over the course of the year, the work happening with the Institute of African American Research with SLATE, their student learning initiative to advance truth and equity. And so there's been a lot of work and initiatives and happening and opportunities happening all across campus. And we'd love to be able to come back and share that work with you in the future. But just as a reminder, because I know it's been a year since Carolina Next was implemented. As a reminder, this is sort of the way that each of the initiatives are designed and are created. So each strategic initiative has captains. Strategic Initiative 1 has co-captains, and Sibby and I serve in that role. And as part of that, there are 3 strategic objectives for each initiative in Carolina Next. And each of those objectives has leads. Now for Strategic Initiative 1, since it's about building community, Sibby and I felt it was really important to reflect what we're attempting to create, okay? So we have not a single lead, not 2 leads for each strategic objective, but multiple leads, and I'll share their names with you in just a moment. Their roles are really to help connect those who are doing the work in each objective, connect them across campus, provide supports to them, and help us track the growth development of that important work happening in strategic opportunities all over across campus. Adjacent to us, though, is this whole, the provost has called this our wheel. This is our group of folks, and each strategic initiative has it, who are sort of advising the work, giving input to the work that's connected to each of the schools and units across campus. And this is our Diversity Council. And so this Diversity Council plays a critical role to helping implement Strategic Initiative 1 along with the strategic leads. And then as you see over on the other side of the slide, the Office of Institutional Research and Assessment are supporting the leads, they're supporting the captains, they're supporting the council, and helping to monitor, assess, and eventually we will be reporting on the progress that's being made. So I think that this structure, I wanted to revisit this to remind us of how each strategic initiative is designed, but specific to Strategic Initiative 1 with Build Our Community Together. And then here on this slide, are the names of the faculty and staff, and we have faculty and staff on each that are serving as strategic leads to help implement and assess progress made on each strategic objective. I can't say enough about these individuals. They've signed up to do this work without really understanding what this all entailed, and we're figuring this out together. And we're tremendously grateful for their time and effort in helping with the assessment and just the collection of information. I can tell you, as part of this effort over the last year, it has been so reaffirming to know all of the good work that's happening across campus. And, I think many of us we understand, we know there's good work happening in pockets, but we haven't done enough to share and to assess as a campus what's happening and how it's progressing. And so this initiative and these individuals are helping us do that work. And we look forward to sharing more of that with you, because it's really, there's some great work happening by great individuals, many of you on this call at Carolina, and we need to celebrate that as we move forward together. So I'll pause there with our strategic objective leads and sort of that infrastructure that we've built. I'm going to pivot to Sibby now, who will talk about that Ferris wheel, that the Diversity Council.
Thank you, Amy. As Amy mentioned, we really have been trying to build a really robust structure that can support this important work. And so the development of a campus-wide Diversity, Equity, and Inclusion Council has been a significant part of that effort. But I think it's important because this is one of the first times that we as a university have really tried to make diversity, equity, and inclusion the core of what we do here at UNC. So it's not designated just to the University Office of Diversity and Inclusion, but we are really seeking to redefine diversity, equity, and inclusion as fundamental, as critical to the mission of our university. And that means creating structures and creating systems where everyone can thrive. And by creating this council, we are ensuring that every school and every division is represented and has a voice. But also as staff, faculty, we want to make sure that there is a person that is designated within your school or division that you can go to and provide feedback and input, or you can go to if you are experiencing a situation or a challenge. So we've been quite pleased with this structure. And I do want to take a moment and introduce my co-chair, Gretchen Bellamy. She is, many of you know her, I'm sure. She has been the Senior Director of the University Office for Diversity and Inclusion over the past almost 3 years. And so she's done a tremendous job and has just played such an important role, both on our Build Our Community Together Leads team and helping to support the development and effort of this council. But the role of this council is really important because it is helping us to really focus our efforts in ways to transform not just the institutional culture, but where people live within schools, within divisions, and at the department levels. And also, they play a critical role as partners in helping us with training, education, programs that are taking place across campus. So as you see here, many of the schools have actually invested in senior level positions that focus on diversity and inclusion. And that is something that has been underway now for several years, but with the focus on making real investments in DEI, we are seeing more schools really elevating this work, professionalizing this work, and recognizing the importance of having someone on each leadership team that has the authority and the opportunity to really affect change. So it's been exciting to see the development of these dean level, vice provost level positions. Next slide. And again, similarly, we now have representation from all of the service areas. So if you are working in facilities, your contact is Anna Wu. If you are in the research workforce, Craig Fletcher within UNC Research is your point person. So we really have tried to make this an integrated structure so that there is a connection between Build Our Community Together and the work that we're doing on the council and with the senior leadership. Next slide. We're also trying to work now with the Employee Forum Committee on Diversity, Equity, and Inclusion. And so I think this group just started this past fall. And what we have done is we've ensured that there is now overlap with the membership of the Employee Forum Committee. So Adriani Gibalisco, who is our communication specialist in the University Office for Diversity and Inclusion, sits on this committee. So there's a direct tie with our unit. But also we have two members who represent not only their divisions, but they also sit on this committee. Adrian Cromwell, who is the Director of Study Abroad, sits on the UNC Diversity Council, and Jen Daniil, who is in risk management and integrity, oversees university policy review, and she also sits on this committee. So I think it's a wonderful opportunity for us to, again, partner, ensure that there is a two-way communication process where the work of the employee forum and this committee can inform the work that we're doing on an institutional level. And also we'll have a connection to all the schools and divisions. This is just kind of an overview of where we are now. There are a few steps that we are taking that Amy referenced. One is the development of a number of subcommittees that are just getting on their feet this semester, that are part of the Diversity, Equity, and Inclusion Council. We have tasked a number of subgroups to look at some of the critical issues that were identified in the UNC system race and equity report, and also the community engagement report. So we're looking at culture and climate of the campus. We are looking at doing an equity review of all university policies. We are looking specifically at some of the staff metrics and sense of belonging and sense of inclusion within their divisions and departments. We are also looking at just overall policies and practices across the campus. So the real goal is to, next slide, is to look at ways that over the next 3 to 5 years, we can bring about a really deep structural and systemic change for our university. We've created the council and created a structure that we think will support this work. We've spent time as a council really deliberating and discussing different frameworks and strategies for change. We've identified some short-term action steps that we're now engaged in. We're working with, as Amy said, with each of the schools and divisions on their response to the Chancellor's questions and some strategic plans that identify specific strategic areas that each school and division wants to focus on around structural racism and equity. But over the next few years, as a community, we are going to really rely on you and try to find ways to involve you to help us build a culture of inclusive leadership, commitment, and accountability. We're gonna rely on you to help us in terms of holding us accountable for reports and making sure that we are communicating what we are doing and finding ways to report back to the community and share data that we're currently collecting. And I think once we get into a process of regularly reviewing reports, looking at goals, re-examining goals, looking at our metrics and data, then I think we're going to have a process that really will lead to an improved culture and climate for our campus. So that's a quick overview with 3 minutes to spare. I want to open it now, if we can, to at least a couple of questions, comments.
I'm sure there are questions. Don't be shy, folks.
You can have access to the slides. We will make sure that this gets distributed to the entire group.
Well, I'll start off. So a couple of comments were made, and I just want to state very publicly, both the Chancellor and I think Amy said that they wanted to come back when invited. So I want you to know you have a standing invitation anytime. We would love to have you. One of the new things we've just created is roundtable with the Provost, because he pointed out he has never been invited. So we quickly corrected that, and I am very happy to make that roundtable with the Provost, the Chancellor, and our Strategic One folks anytime. So please know that this is a standing invitation to come back. And the reason why I feel like I need to say that is because I think the sense of belonging, the sense of creating a community together, diversity, equity, and inclusion has been the defining issue in my leadership role here, even more so than COVID. I think exacerbated by COVID. We need to work harder and create a sense of belonging and inclusion and diversity, a rich tapestry where we can all feel included and where we can all thrive. And so I want to publicly state you have a standing invitation. We want to know what you're doing. We want to know how we can help. Most of us are boots on the ground. We may feel and sense things that you may not. And we would love to have the opportunity to share those experiences with you. We want to be compassionately direct with you. And we want that to be an invitation, because sometimes we don't feel that is welcome directness. And so we are asking to partner with you. We are delighted that you're here, and the invitation is standing. And I don't want to take up everybody's time. So please, folks, anybody have any questions?
Yeah, I see a couple of questions. So we do have regular meetings of the DEI Council. Right now we are meeting once a month. But as Gretchen mentioned, we are now kind of rolling up our sleeves and really investing in the work of the subgroups who are going to be looking at data that we've collected related to staff, faculty, and students. They're going to be putting forward recommendations. So really the opportunity to engage will be with those subcommittees. And so once those subcommittees, they're spending some time right now just getting organized, but we will begin to publicize opportunities to visit with those subcommittees, we're going to be sharing data and asking for feedback and input as we try to make sense of that data. So there are going to be opportunities that will be announced and publicized for the community to participate in. And I think there was another question about how does it overlap with DEI? Well, I oversee the University Office for Diversity and Inclusion, and Gretchen serves as the Senior Director of that unit. She sits both on the Build Our Community Together leads and is the co-chair of the DEI Council. So there's a lot of overlap. So these are very connected. These are not, I think in the past, we've often had a lot of siloed efforts, everyone doing something separately. And what we're trying to do now is think of it as an intricate web where everything is connected. That is going to allow us to really affect change and work together as a community. I did see a comment from Gloria about the liaisons. Right now, we've shifted the focus, the structure a bit, where we still have department liaisons, but we are asking you to work with your division level liaison. That is the main contact. And so any unit for you under the provost, I would be your contact. But I think the important part is that we're going to get to a point in this semester where, whether it's part of the outcomes assessment process or separate process, we will be asking everyone to share their metrics and share data. And so expect to hear from our Build Our Community Together leads and members of our council who will be requesting data and asking for information, and certainly Lynn and her team in institutional research.
There's a question about submitting anonymous. I wasn't quite sure if that was meant for us, but submitting anonymous comments or concerns. And so I guess all I'll say to that is you can feel free to reach out to Sibby or I, but recognize we are responsible employees. And so there are three mechanisms in which you can use to share your concerns. That's EOC, the Ombudsman, and then the Employee Management Relations. So I'm not quite sure what that is, but if you want to talk with us more directly, please feel free to reach out to us.
Instead of typing, can I just ask about next steps? So I understand now that Debbie Clark is my liaison, and I see I should reach out to her. And Sibby, you just said as a member of the Provost Office leadership, I could reach out to you too. What are the next steps, and what do I do next if I contact you and Debbie? Is there a survey I'm completing? Are we all doing the same thing so that we're doing uniform kind of work and metrics?
That is an excellent question. There's been a few years now where we have not been doing regular reports or keeping metrics. For this year, we are focused on racial equity. To be quite frank, that we are using the questions posed by the Chancellor to our senior leadership around how do we stand against structural racism and stand for equity. And so I would say that this year in particular, we are focused on kind of the broad picture of where are we as an institution in terms of race and equity. And so we are now currently working with all the senior leadership from every academic school and division on a 2020-21 report. And then at the end of this spring, we will be sharing that report. And as we go into the next several years, we will have a set of metrics. It's taking some time. And part of that is we're just now getting the subgroups working. And we don't want to rush into a process where we haven't given the community a chance for feedback and input. So this year really focuses on race and equity. And then as we go forward with the subcommittees, there are going to be opportunities to hear from you. You know, how do we ensure that we're not just looking at issues around race, but how do we make sure that we're looking much more broadly, gender, LGBTQ, identity, disability, visible, non-visible. So I think it's important that we take some time in terms of developing what might be a standard set of metrics that speak to diversity, equity, and inclusion much more broadly. Does that help? Does that make sense?
I will reach out so that I can get a clearer picture of it. Thank you.
And I'd like to add too, we'll certainly share these slides so you know who all your contacts are, whether it's with the strategic initiative leads or through the diversity council. But I do know the strategic initiative leads are reaching out to individuals that are doing work under the strategic opportunities, which were not reflected in these slides, but will be available when the Carolina Next website goes live, which I believe is later this month. Some of you are doing this work, but it's not always been recognized as being connected to this work. So a lead may reach out to you and say, it seems as though you're helping to provide equity with respect to digital lifelong learning, because students living in rural communities, low-income students, are getting access to broadband that maybe they haven't had, or digital connectivity that they haven't had. So there are ways in which we are exploring equity on our campus, and much of the work that many of you are doing is connected. We just haven't thought about it that way. So if you hear from one of the strategic leads asking about some of your work, trying to understand better how it's connected to Strategic Initiative 1, that's that we welcome you to engage in that process. So we'll share those names so you'll know who all those individuals are, because they're in this presentation. But you know, equity is a true effort along with race this year. And so many of you are connected to that work, and we want to make sure that we're understanding what's happening across campus and how folks are actually implementing and building community on campus.
Shana, this is Kevin. So I need to jump into my 10 o'clock meeting, but I just want to again thank you for the invite. I want to thank Sibby and Amy for their incredible leadership on this initiative. As I've said repeatedly, that if we get this first strategic initiative right, all of the others, the other 7 in our strategic plan, Carolina Next, will come together in a meaningful way. But if we don't get this one right, the others, I don't think we can accomplish. And so I know Bob Blouin, who's going to be speaking soon, our Provost, is committed to this. He and I just had a conversation on Monday evening around a few diversity initiatives that we want to continue to keep on the right trajectory. We want to hear your voices, whether that's anonymously through Shana, Amy, or Sibby, all who have direct input to me at any point in time. Or feel free to reach out to me directly or to Bob. We want to hear your voices. I'm serious whenever I talk about the compassionate directness. That's the only way I think we're going to move forward. And that quote from Mariana Huffington really resonated with me. So with that, I'm going to say goodbye and jump into my next meeting and wish you well for the rest of your meeting today. So
thank you very much.
Thank you.
Have a great day.
Bye-bye.
So are there any last questions, or did you want to end with anything? Amy, Sibby, Chloe, Gretchen?
I just want to thank you again for the invitation. It's my first time as the Interim Chief Diversity Officer visiting with the employee forum. So I think this will be the first of many, I hope, visits. We are committed to partnering with the employee forum and making sure that we keep you up to date on the progress that we're making. Thank you.
Great, thank you so much. And shame on me for not inviting you sooner. Have a great day. Thank you very much for your presentation. And now we're moving on to something we've never done before. Is our Provost here?
He is.
Awesome. This is the inaugural roundtable with the Provost.
All right.
Welcome.
Thank you, Shana. How are you doing?
I'm doing well. I'm feeling hopeful this morning.
Well, since this is the inaugural and we haven't done this before, maybe you might summarize what you would like to get out of the roundtable, and I can certainly start off with some general comments and open up for questions. Let me ask you to frame it.
Well, so some of the things I think that have been coming back stem around where we are with the numbers in Orange County, the vaccine, testing. I opened earlier, I'm not sure if you were here when we were talking about order of priority for the vaccine. Is there anything that you can talk about there? I may have misspoke, but I think Lee County moved into 1B yesterday and Orange County may be in 1B, if I'm not mistaken. And so there have been questions about what education, I think, is in 1B. Frontline employees include education. Is that us? What does that look like for us? Those were some of the questions that I've been having. I also received a report that a staff member tried to get a test and was turned away. And so can you clarify what the testing for staff looks like?
Yes. I can do all of that, I think.
Great.
So let me first just thank you, Shana and Katie, for the standing invitation to be a part of this meeting, and it is on my calendar, and I certainly look forward to meeting with you on a regular basis. And I do want to just extend to all of you the happiest of New Year's. I know that. Well, I hope I can speak for everyone. We're happy to get rid of 2020. And you know, I have promise for 2021. I think that there is hope for us. And there are certainly, I think, many reasons to be hopeful in this year. So, and one of the reasons for hope is the progress that has been made with regards to the vaccine. And I will talk a little bit about that in terms of what I understand is going on at the state level and how we can proceed with that. But before I get into that, I did want to just acknowledge Sibby and Amy for the incredible work that they have done with Strategic Initiative 1 and in general, you know, on our strategic plan. As you know, there are 8 strategic initiatives to the strategic plan, and actually I was invited. I think maybe a year. I think not too long after the strategic plan was approved by the Board of Trustees, which is just about a year ago. I did have the opportunity to visit with the staff and council and had a chance to articulate the 8 strategic priorities. And so as you listen to a fairly detailed presentation of Strategic Initiative 1 and the pinwheel concept and how the intent here is to diffuse across the entire campus, you know, the various initiatives, objectives, and opportunities. And the only way we can really fully accomplish this is by engaging our entire community. And so strategic plans are very difficult and very challenging to implement. And I think the way that Sibby and Amy have designed it, it has been a model for all of the other strategic initiatives within our strategic plan. And so I'm very, very proud of the work that they have done. And I do just want to remind everybody that it is our hope that we will not be redoing our strategic plan every 3 years, that this will be an evergreen plan. And the 8 strategic initiatives that have been identified, we believe with maybe some modernization or updating periodically, that they can live on. And certainly this Strategic Initiative 1, and to paraphrase you know, the Chancellor's words, that this was certainly our most important strategic initiative by which all of the others are built. And so we cannot be successful as a university, and we certainly cannot be successful as champions of the strategic plan if we don't get Strategic Initiative 1 right. And so I just want to thank them and thank everybody who has been working on it. And I am particularly proud of the way that they have chosen to attack structural racism at this university. Something that I know is very much on people's minds, and we will not be able to make the progress at the national, state, or even local levels unless we acknowledge some of the history that is in place here on this campus and the history of this state. So I appreciate the fact that the leaders of that particular initiative are willing to take this on. It's not going to be an easy thing to take on because many of these things are very subtle and very nuanced in the general operations of the way our units function. But we do have to be honest with ourselves and tackle this in a very straightforward and forthright manner. And so the other thing that I would just say about the plan is that we assess it. We will be assessing the outcomes. And I think that Sibby indicated that we're sort of in a assessment mode at the end of each calendar year. We will look at whether or not we've been successful in accomplishing the objectives and the opportunities that have been outlined within the strategic plan. So I want to empower all of you to feel that you are a part of this plan. And if you have interest in participating in it, please let Sibby and Amy know. So with that, let me tackle some of the very specific questions, Shana. I'm sorry to have taken some time on the strategic plan, but it's really nice to talk about something other than COVID, because it does occupy a lot of my my day-to-day life these days. And I do like to remind myself, if not others, that we are a great university because we are committed to pursuing a great mission. And so we cannot let COVID-19 prevent us from pursuing the mission of this university. So thank you for that indulgence. So let me talk about the numbers first. I think we are all worried about the numbers. At the national level, at the state level, the numbers are up. I believe the numbers that I received yesterday indicated that the positivity rate within the state had gone up over 15%. I think the positivity rating in Orange County has gone up. I'm pleased to say that the positivity on campus has not, at least as indicated by the volunteer testing that has been taking place on the campus. Now, you are right that if you go to the Student Union building before the 11th of January, that program is still in place for students only, but that will change effective in next week. When the new lab that has been stood up by the university is in place. And so it's, I might be wrong on my date, but it's either the 11th or the 14th when the new lab will be up and running. And once that lab is up and running, all faculty, staff, and students will have access to that. In the meantime, there are other, site at the Ambulatory Care Center, as well as other sites that have been identified by Campus Health or Occupational Health are available for non-students on campus. But we do understand that that is has been a limitation for some, although I think that employees have had access to testing independly of that. So starting next week, everybody will be able to go to any of the 3 sites for their testing. Staff are, we've had the conversation about mandatory versus non-mandatory. We can get into that again if you'd like, but you have the opportunity to go and be voluntarily tested at any point. And so, and I know that the guidance is once a week, but if you feel it's important to be tested more than once a week, nobody will be denied a test. And so we are encouraging, strongly encouraging that everybody, who is in a situation where they feel they need to be tested, that they should be tested. But there, the 3 test sites will be the student union. That represents sort of a central campus location. The North Campus location will be the facility that we call Current. It's a facility that is associated with our arts activities, and that was chosen mainly to have access to busing and parking, so that you can more conveniently drive up and into that area to get tested. And then the final 3rd testing site is at Ram's Head. So we have the capacity to do about 7,000 tests a week. So that should be more than enough to fulfill our needs as a university. And we feel very good about the capacity to perform these activities. It will be a PCR-based test. It will be a mid-terminus sample collection. So if you're familiar with the brain tickle sample, it is not the brain tickle. It's not that deep penetration high into the nostril area. It's putting a Q-tip type probe in the middle of the nostril, right around here. It's painless, and it is self-administered. So you do a self-administered swirl on your right, and then on your left nostril, you put it in a container, and then it gets run. And we do believe that we're very comfortable in saying all test results will be available within 24 or 40 to 48 hours, but we do think that will be more rapid than a 24-hour test. So we feel very good about that. We are also going to be experimenting, and maybe that's not the right word, but testing out for ourselves some of the quick tests. The test that we will be primarily providing for everybody will be a PCR test, which is the gold standard test right now. There are a lot of things emerging in the marketplace for quick tests. We want to begin to look at that as an alternative to the PCR, mainly because of its convenience and its speed, its access, and its low cost. So all of these tests, though, regardless of what the price is to the institution, are going to be provided to all of you at no charge. So I don't want you to be concerned about that. We are well aware of the vaccine rollout and the challenges associated with the vaccine rollout. Shada, I think to your point, we also have been lobbying to the state to rethink the characterizations of what we would call essential personnel. And there is a lack of clarity around these definitions. We had a fairly lengthy discussion about this yesterday and on Monday. And as I understand it, there are discussions taking place in Raleigh today, I believe, to look at the current interpretation of the definitions. As I understand it, the state's Health and Human Services has been primarily following the guidance of the CDC, although they have latitude in terms of how they interpret those guidances. And that's how the characterizations of 1A, 1B, 1C, 2A, 2B, 3, et cetera. There are a lot of gaps, and for me, the 2 biggest gaps is that when they talk about educators, they're only talking about K through 12 instructors or teachers, when we would very much for them to include university under this consideration, and university faculty and RAs and TAs should all be included. We also believe that university staff should be included as they are identified as frontline workers, very similar to the way frontline workers in the UNC healthcare enterprise has been identified as a frontline worker. So we have been championing that those changes get made to the designation of critical workers. And so I don't know yet as to whether or not that has been adopted or that definition is going to be changed. I will continue to have conversations with the Orange County Health Department to make sure that they are well aware of our repeated desires to have those two categories of personnel modified in order to get quicker access to the vaccine. Now, I know that there are some very practical issues in terms of the delivery of the vaccine. There's still a lack of access to the vaccine in terms of just having the quantity of vaccines available to our community in a way that we can effectively distribute them. So I don't know if that totally addresses your question, Shana, or your advocacy, but I just want you to know that we share your advocacy position. Kevin and I have talked about this, and we have advanced this to the state level.
Great, thank you so much.
And then as far as the order of priority, I think that was consistent with what I just mentioned. It will require some organization on our part, because lists need to get formed. And so I know that occupational health has been doing a very good job of working with the state under the current guidance. And as soon as those guidances are modified, I know that they are committed to realigning those lists if those permissions are given to them. I think the biggest challenge is the actual rollout of the vaccine itself and getting enough sites, to make sure that once the vaccine is available and the prioritization is clear, that we then are able to deliver the vaccine to all of our community, and the faster and the more efficient way in which we can do that, the better. It is not it's not an easy process. It is a somewhat encumbered process. It requires a prioritization. It requires going online to register, to make an appointment, and then to come and show up on time. I know that there have been inconsistencies in which people have been showing up. And so I do fear that we're not taking full advantage even of the vaccines that we have. So I would favor a more aggressive, more liberal distribution method. I think right now it's a little bit too hierarchical, and it's really slowing things down quite a bit. And I guess we're all worried about the effect of not moving fast enough, that means that another person could be exposed, another person could get sick, and another person could end up in the hospital in an unfortunate situation. So those are, I guess, some of the bigger issues. The rollout of the testing and the plan for the campus is going to be continued regardless of what decisions are made with regards to modification of the campus plan. So I think what is clear is that the semester will start. I think we all realize that the semester is going to begin. It's going to begin January the 19th at the undergraduate level. Some schools have already begun their semester. We are also recognizing some of the differences in terms of the rollouts, undergraduate students versus professionals and graduate students. Their rollouts are different, and we have given a fair amount of latitude to the schools, mainly because of accreditation and because of so many nuances associated with the different professional programs, the way their programs are structured, the way they have to incorporate experiential education, that unfortunately we're not able to impose sort of a single rule, around the entire rollout of all aspects of the spring plan. So you will notice that there are some differences, say, between a health sciences school, and the college in the way that things might be rolled out, and the way that they might be enacting guidances or even rules by which they might be operating. And so the university has tried to make sure that every school is operating in a maximally safe situation, but still trying to be responsive to the individual needs of each of the professional programs. As one of the things that we do not want to do is to slow down the training of our healthcare professionals, because right now they are very much needed in our workforce. So, so I'm happy to take any questions on any of these issues, as well as any questions that you might have on a totally different issue.
So I think something came in the chat. Does anyone know how the hierarchical distribution is being verified?
A hierarchical distribution of the vaccine?
Correct.
Yeah, the hierarchical is not, when I said that, I may have misspoke in terms of hierarchical being leadership hierarchical. There is no such hierarchical. The Chancellor, the Provost, we will not get our vaccines until the health department tells us it's our turn, based upon whatever criteria that they are using for everyone. So the only thing that I meant by that is that there's a structure, a hierarchical structure to the way the vaccine is being distributed based upon criteria. And so I don't think that that's going to change at the state level, and certainly that will not change at the Orange County Health Department level. What we're trying to do is to get more of our frontline workers, our faculty, our TAs, our RAs, and our frontline staff workers to be treated in a similar way as K through 12, and as a similar way as our healthcare workers are being treated in the front lines of providing infrastructure support for our healthcare enterprise. Because many of our staff are, associated with providing services that you're interacting with a large number of people, and even though we're assuming everybody is going to be compliant with our community standards, we know that the more people you interact with, the greater the transmission risk.
I think that's all that have not been answered in the chat. There were some questions about the hall pass, but apparently that won't be live until the 13th.
Yeah, just to remind everybody, so if you get the test is pushed out, through hall pass, and as long as you have a PID number, then that can all happen. And so if there are issues once you start going for testing, please let me know. I will do everything that I can to make sure that any issues or concerns or things, if they're not working properly for you, please let us know as quickly as you discover it, so that we can make whatever changes. We are not going to achieve perfection. I just want to forewarn everyone, this is not going to be something that is going to work like clockwork. There will be things that will go wrong somewhere along the line. Hall Pass is a creation of one of our own faculty members. This was developed here on site. We are very excited about it as a tool, for us. But we also the Hall Pass it will be available on the 11th, Monday the 11th is what I've just been told. And so there could be some glitches, particularly at the launch. So if you discover them, please let me know, or let Amir know, or anyone who is in a position to act upon those issues. Okay, don't let them fester.
So I think somebody clarified their question. What she meant was, how is it being verified that the person receiving the vaccine is in the correct wave?
Yes, that is a really good question. And I've asked that question myself. I'm not sure that I have received the best of answers. I believe right now, unless otherwise proven, I think it's the honor system. I think the reason why age has been used as the predominant criteria is it's easy to verify. You don't need a medical record. Because UNC Healthcare is allowing or will be vaccinating people who are not part of their system, that they will not have their medical records available. And so I think it's going to, my understanding is it's going to be based on the honor system. But I think there will be some obvious challenges. Age might be one. That right now the priority is everyone over 75, regardless of secondary illnesses associated with it.
Any other questions? One more from the chat. For employees testing this week at the ACC, you must be in a car to be tested. We have staff members that need to go to campus this week and want to be tested, but don't have cars.
Let me check on that. I believe that Orange County has had testing sites. I thought the R17 lot is still being used, but that, I guess that still is, let me check on how that would be handled.
Right. And here's a question about the COVID-19 wellness check site for employees who use Karen, Burmese, and Spanish as their primary language. Do we have something for these folks?
Yeah, that has been a problem, I think, at the state level as well. Everything has been written, I think, to date in English. And so I know that we had talked about the website being changed to be modified to include a Spanish option. So let me just, again, double check to see where that is.
Great, thank you. I think I've covered everything from the chat. Does anybody else want to, you don't have to put it in the chat, you can speak right up.
Hey Bob, how's it going? Happy New Year.
Happy New Year, Katie. Good to see you.
Doing well. I had a question for you. One of the things I've really appreciated in the past couple of months with the Campus and Community Advisory Committee meetings that have happened since the fall semester, they've been readily available and put and posted on the faculty governance website and on the employee forum website afterwards for folks to watch who weren't able to watch live in person. I was hoping that something like that could be continued for the staff advisory committee, because I had a couple folks reach out that couldn't attend the live event just at that particular time. And it was a struggle to find a place to point them to as far as how to watch the live, the feed after the fact. So similar to the faculty advisory committee, it'd be nice to have kind of those meetings and the staff advisory committee meetings posted on the faculty governance and employee forum websites respectively, just as a tool to help kind of engender that transparency that I think we've been pleased to see with the CCAC committee this past semester.
Yeah, the staff advisory committee is the Chancellor's committee, and I certainly will bring that up to him. I don't know whether or not he has a preference in terms of being available generally to the public or not. So I have not talked to him about that. So I will raise that question.
I do know they're open meetings, but just as far as for those that can't attend live, like that's the struggle. I
mean, personally, I don't see any obvious reason not to. You know, I think the whole point of these meetings are to improve communications and improve dialogue. And I don't know, Amy, if you Amy Hertel, if you know if there's any reason why we couldn't post those meetings.
No, I don't see any reason at all. And I think the question was where would it live? So if the employee forum is willing to take those recordings, we'd be happy to have those posted so that.
Yeah, I think that that format was kind of created with the CCAC, that the faculty governance website and the employee forum website would each post those links for people who are looking to watch those. So we could do the same thing with both the faculty advisory committee and the staff advisory committee.
That's great. Yes, we can work on that and make that happen.
Thank you so much.
Shayna, this is KJ. I work in infectious diseases. I just checked on the question about can you walk up to the ACC RDC Center to get tested? And that answer is no. You have to be in a car.
Okay.
I can send you the COVID testing sites that are at the Newman Center and the R7 parking lot information. If Shayna, you want me to send it to you, I can.
Sure, or if you're at a place where you can post it in the chat, if not, send it to me and I'll get it out.
Well, it's in a text message, so I can't do it on my phone.
Okay, just
I'll forward it to you.
okay, great.
Thanks.
Thank you for that clarification.
Any other questions? And I was corrected, so I want to state that this is not the inaugural roundtable with the provost. This is actually the second one.
This is Shayna's inaugural.
I was told that Katie masterfully facilitated it in December in my absence. So I want to state that correction.
So I just posted this in the chat, but maybe it's easier to read it aloud. And I may have missed this, so I apologize if I did. Will the R7 testing lot remain open next week after the 3 campus testing sites open?
I think I need to look into that. I believe the R7 lot testing is hosted by Orange County.
Yeah, R7 is hosted, and we had extended permission for them to continue to use it. I just don't know whether or not they are planning to use it for that. I know they also have requested access for vaccinations, locations for doing that as well. So that's under the auspices. We have provided them all of the spaces that they had requested. They have been very pleased with the R7 lot and the service that they've been able to deliver to the community there. I think they've gotten a wide swath of people from different parts of the community, and I think they want to continue to use it for that purpose. But I'll check with Erica.
Thank you.
Any other questions for the provost? Well, in the absence of other questions, I want to thank you for your second roundtable with the provost and the employee forum. We were delighted to have you.
It's good to see you. Thank you very much. Appreciate it. And I hope all of you have just a great new year. Be optimistic.
Absolutely. Happy New Year to you too as well.
Okay, thank you.
And so now Link reached out to me and he said he was flexible with his time. Thank you to Becky, Link, and the HR team. We are now moving into your updates.
Hello, everyone. Happy New Year. Thank you, Shayna. It's good to see everybody. Becky is taking a few well-deserved days off, so I'll be providing the update. Jessica Pygis is also with me to give some quick wellness updates for the new year. You may recall from the meeting in December, Becky provided an update that was basically, here's all the things we're anticipating will happen related to the work and leave provisions. And so I'm here to tell you what we were anticipating. All of those did come to fruition for the most part, not everything. So just to sort of recap, the Federal Families First Coronavirus Response Act, FFCRA, did expire on December 31st. Unfortunately, it was not extended into the new year, but there are other options available to employees in terms of folks who need leave for COVID-related reasons. You may recall that we have instituted a leave bank that's still available to employees for that purpose should they need leave. The good news around the leave bank is the donations are far outpacing the need. And so there is plenty of leave available right now. We haven't had a huge demand for it. We have had some employees take advantage of it. That's what it's there for, obviously. And But the good news is that we do have a pretty robust balance right now to be able to provide leave should other employees need to take advantage of that. The other good news is that the ability to use accrued leave interchangeably was also extended at a minimum through the end of March. The system office is pushing for that to be extended through the end of the calendar year 2021. So we're kind of waiting to hear back on that. And that means that, you know, for folks who have sick leave balances, they can use that as vacation leave for COVID related absences like child or elder care, unable to work, unable to telework, for example. So that is something that's still available at a minimum through the end of March, but we're hoping that that will get extended through the end of the calendar year 2021. In addition to that, there is COVID paid administrative leave available up to 160 hours of cumulative paid administrative leave through the end of March of 2021. And these are for the following conditions: if an employee is subject to a quarantine or isolation order, if they've been advised to self-quarantine by a healthcare provider or a public official, or if the employee has had exposure with someone who tested positive for COVID-19 and is awaiting diagnosis. And the way that rolls out is employees can receive up to 80 hours before using their own leave or having to exhaust their own leave. Should they exhaust their leave, they would then have access to another 80 hours of the paid administrative leave in that situation. And then, of course, in addition to that, we have the leave bank available should folks need additional leave beyond that. So a few of those things that Becky talked about in December did come to fruition as we anticipated. There are a number of other things that are still being discussed and advocated for, not only from our office, but other universities across the system and the UNC system office. There's still not been any firm word or confirmation about the potential of a early retirement option. I think the folks at the system office are optimistic that that will be something that will get passed, the timing of which we're just not sure. Again, that's going to require some legislative activity in order for that to happen. So again, just wanted to provide you with the updates of what we know right now in terms of the work and leave provisions. I do see a question in the chat. When this is all over, what happens to leave in the leave bank? Is leave bank something that is going to stay post-pandemic? If not, what happens to the donated leave? Just like we would do for the shared leave bank, we are tracking who's donating what hours. And for the regular shared leave bank, what we do for those unused hours that are donated toward an individual, those get then returned, and if necessary, on a prorated basis, depending on how many people donated and how many hours they donated to the full balance of the bank. So those leave hours wouldn't be just lost. They would be returned to the folks who donated them, possibly on a prorated basis, depending on how much leave is used. So that's my quick update. I know we're a bit behind schedule, and I do have Jessica Pyges here who can provide some quick wellness updates. I'm happy to still monitor questions that come in through the chat and do my best to answer them, but also want to be sensitive to your agenda and time. So Jessica.
Thank you, Link, and Happy New Year, everyone. I wanted to just give you some brief reminders and just some updates of what resources are out there to help you stick with those New Year's resolutions if you did set them. So as we've been speaking much about, 2020 was a very insanely crazy year where we had to make so many adjustments. So one of your New Year's resolutions might be to be more mindful, to have more self-compassion, and to reduce stress. So I do want to let you know what resources are available for those. There are weekly mindfulness meditation, self-compassion sessions, which are led from the School of Medicine. They are not limited to people who work for the School of Medicine. They're available to anybody at the university to participate in. They are available 3 times a week, Mondays at 12:15 and Tuesdays and Thursdays at 4 p.m. and are approximately 30-minute practice sessions. I'm going to drop in the details on who to email to get signed up for those, but there are 2 different contacts within the School of Medicine, Johnny Gherkin and Jennifer Tauber, to sign up for those sessions on Monday, Tuesdays, and Thursdays. There are also monthly Mindful Mondays led by Mindful UNC. So those will start Monday, February 1st. Those are in the morning at 8 a.m. to start your day and regroup and get prepared mentally for the work week. And those are a little bit shorter. They're 20 minutes. If you have an interest and experience in leading a meditation session for Mindful UNC or a stretch session, they are looking for volunteers. They like to have someone new every single Monday of the month for the semester. So I will drop all this information in the chat box once I'm done speaking. And then our Wellness Wednesday sessions for this month are mindfulness in your work and life. That's going to start Wednesday, January 20th, right after the Martin Luther King Jr. holiday. That's during that lunch hour from 12 to 1. And then the second one for the month is Reduce Stress with Humor. That is the 27th, the following week. Again, on Wednesday, we have all our sessions on Wednesday this semester. And that is also from 12 to 1. Feel free, of course, not to eat lunch while you're participating in those. I do want to remind you that our Wellness Wednesday sessions that are coordinated by Total Wellbeing, those are now in the Carolina Talent System. If you've not been in there, I encourage you to go in there. It's accessible through Connect Carolina. You're going to click on the self-service tab and then My Learning. You can view upcoming classes, both wellness classes and professional development classes within the calendar, or you can search keywords and they'll suggest some upcoming classes for you. If your New Year's resolution was to get a little bit more physical activity into your day, this is a popular one. I do want to let you know that campus recreation has definitely adjusted to our new virtual environment, and they have many, many classes that are available for you to take anytime for free. These classes are on-demand fitness classes. The videos are on YouTube. They are from 15 minutes to 30 minutes pre-recorded classes, and I will drop that link in the chat box as well, but you can find that information on the campusrec.unc.edu website. If your New Year's resolution was to manage, lose, or maintain weight that you may have lost during this work at home time, I do want to remind you that Eat Smart, Move More, Weigh Less is still covered at no cost to state health plan members through June 30th of 2021. So it is free for you with code GNC 2021. That is the 15-week weight management program. I will put that link in the chat box for you, but want to let you know that these classes are filling up really, really fast. All of the January sessions are already full. So the next round of classes begin February 15th. If you participated in Eat Smart, Move More, Weigh Less within the past 9 years and had good attendance, you attended 10 of the 15 sessions, then you're eligible to participate in Eat Smart, Move More, Weigh Less 2, which is free for you with code GNC2 2021. And that is to help you maintain and keep you losing weight if that's what you need to do. It's a little bit shorter of a program. It's 12 weeks, where the initial class is 15 weeks. And then just to let you know, January is a month where health and wellness tends to be on people's minds, although I believe it's been on people's minds for pretty much the full year. But we do have our Total Wellbeing Employee Interest Survey that will be coming out to employees later this month. It is the annual survey so that I and wellness champions are aware of what your wellness interests are for the year. This helps wellness champions set goals with their wellness committees, as well as me as I plan for the upcoming year. The survey should not take more than 10 minutes. It's been updated since last year to accommodate our virtual settings. And I do encourage you to take that. Would love to hear from you. Last year, we had just about 1,700 complete it. So I'd love to get more than that this year. And then our discounts are focusing again on how to stay healthy in the new year. And I encourage you to check out the Working Advantage website. I'll insert the company code in the chat box as well, but they have health and fitness discounts. These include discounts to virtual trainers and exercise programs, workout gear for home, supplements, and meditation apps. And then they also have many discounts on healthy meal packages, including those popular names, Blue Apron, HelloFresh, Sunbasket, and much, much more. So as a UNC employee, you get discounts to all of those. And I'm happy to answer any questions that you have. Yes, I see that one is in the chat box related to Eat Smart, Move More, Prevent Diabetes. That class does have a small fee of $30 up front. And that information you can also find on the Eat Smart, Move More, Way Less website that I'll add in the chat box. Any other questions?
There was a question regarding the cost of Eat Smart, Move Less if you're not a member of the state health plan.
It depends on your health insurance. I'm familiar with the state health plan because that's what the majority of us do have. So it is covered with that code at no cost. It might be covered by additional plans. I can't say that it's not. If you have a different Blue Cross Blue Shield plan, it's most likely covered. But if, say, you don't have insurance or an insurance provider that does not cover that, it is about $230 some. So you're getting quite the value. Yep. Thanks, Jen.
Any other questions for Jessica?
All right, thank you so much. I wish you all very good, healthy, happy January. I'm going to drop some links in the chat box now. Hopefully it won't be too distracting, but I just want you to have all that information. Thank you all again.
Jessica. Thank you. Happy New Year.
Happy New Year.
And Link has put in the chat that he's getting several questions, both privately and in this chat. So did you want to come back on and share with us, or did you want to handle that differently, Link?
Yes, Jana, what I'll do, since there are quite a few and they range a number of different topics, looking at the time, I'll draft up responses. I've copied them out of the chat box, and I'll draft up responses and send them so that you can get them out to the group.
Great. Thank you, Link. Appreciate it. So next, we'll move on to the consent agenda portion of our agenda. So is there a motion to approve the consent agenda?
So moved.
Does anybody want to pull anything out for discussion? Communications, community service, diversity, equity and inclusion, education and career development, membership and assignment, personnel issues, recognition and awards, staff assembly. Okay, is there a second to approve the consent agenda without pulling out any issues?
Jen, I second.
Demarches, I second.
Anybody opposed? Okay, the consent agenda is approved. We're moving on to old business, of which we have none. Anybody, the new business that we are discussing today, I want to remind everybody that we do have a joint employee forum faculty council meeting. It is the second one. The first one, again, was masterfully facilitated by Katie Musgrove. The second joint employee forum faculty council meeting will be Friday, January 15th at 3 p.m. And we will post the information on the website about the Zoom. Please, if your schedule permits, please join us.
Can I ask a related question?
Sure.
We discussed after the first joint meeting that we would gather questions, put them on our website, and then post answers. Can I just ask for a status update? And part of that's my fault because I have not looked at the website. So I take at least 90% responsibility for that, but thought others might benefit from hearing an update too.
They are posted. The questions are posted. We have not heard anything back from Becky, who has received the list as far as the answers to those questions go. So as soon as we get something back, we will of course post it.
Great, thank you. And of course, we will do the same going forward. Any other questions about the joint employee forum faculty council meeting?
Christy had a question in the chat. Is it open to all staff? Yes, I think this is an open meeting to anybody on campus who wants to attend.
Will it be streamed via YouTube again?
Yes.
Great.
And we will post that information on our website, and I will also try to get it out on the listserv. Any other questions, comments about the joint meeting? Okay, the second item on new business is the Vice Chancellor Representatives meeting is Thursday, February 11th. Matt will be sending out the Qualtrics. So if you have questions you want to bring to that forum, please look for Matt's email. Is there anyone who wanted to bring any additional new business to the table? Going once?
Sorry, can I back up again and
Sure.
talk about the next joint meeting? Is there anything that you need from us as a forum body to help prepare for that meeting? Like, do we need to come up with questions for that one as well, or?
I am meeting with Mimi this afternoon. We should have a clearer picture of what that looks like, and I'll reach back out.
Sounds great. Thank you.
But to put to the broader audience in this meeting, if there are things that you want to see addressed, please send me an email or Matt an email and let us know, and I will be sure to bring those to Mimi.
Shayna, do you want to have a meeting of the executive committee like we did before the last joint meeting to plan and assist you in any way we can? Because I think the timing of the last one felt like the executive committee felt like the Tuesday before the Friday faculty council joint meeting, but it didn't work out that way this time. But I didn't know if that was something that'd be helpful to you.
That would be great. Let's plan on doing an ad hoc executive committee meeting.
Do we want to just move the next Tuesday's executive committee back a week? Is that something that people would be amenable to, or do we want to have 2 weeks in a row?
Let's, Matt, can you send out some sort of communication and see if that works with everybody's schedule?
Yes, I will.
Great. Good idea, Katie. Thank you. Any other items for new business? If not, you have 25 newfound minutes on your schedule. So with no further suggestions, is there a motion to adjourn?
I'd make a motion to adjourn.
Anybody opposed?
I second the motion, but I also want to draw people's attention to the fact that the vaccine trials are still open. Novavax has been launched. I have a message up there in chat about it. And Dr. Fauci says it's still a very good deal. So I'll leave that with Dr. Fauci. But I put in the chat my number to reach out to me, or you can find my email easily. We opened the actual visits for this vaccine trial, and you stand a very good chance to actually get the vaccine.
And I want to second that. I'm actually participating in the trial. It was delightful. The process is very clear, concise, transparent, and the staff is good. And I took the vaccine, on Monday, and I haven't eaten any brains yet. So I'm still a person, not a zombie.
Great.
Feel free to reach out to me directly. I'm really concerned about my staff that I support not always being able to connect with housekeeping and maintenance staff because schedule overlap is a challenge. Reach out to me directly. I'm happy to help. Anyway, I second the motion to adjourn. Besides that.
Well, thank you for sharing that with us because that's really important. So please, before we adjourn, I'm trying to find the information in the chat. Will you quickly?
I'll put
contact in the chat.
I'm going to put my cell phone for the study right here, and I am a direct pipeline text me though, so I know. I mean, I've gotten a couple of texts since I threw that message up there, but let me throw this out again.
Great.
Liza, Novavax. Go for it.
Awesome. I'm just going to read it out.
Thank you so much for sharing that. That means a lot to my team.
Absolutely. I'm going to read it out for those on the phone. If you're interested in the Novavax vaccine study, contact 919-360-2247 with a text, and then someone will get back to you. Is that how you prefer?
Yes, and we're prioritizing people who are at high risk of exposure due to their jobs or what they do with their time. If you're high risk because of a healthcare complication, that's important also. But to prove this is effective, we need people that are more likely to be exposed. And I am concerned about what I see as gaps in that grid for who gets prioritized for approved vaccines. I also want to say our experience so far with the other vaccines is that the placebo group gets fast-tracked into real vaccine once we get the initial efficacy and safety data. But contact me for more information.
Great. And Joe is asking, can we share this outside of the forum? I would assume the answer is absolutely yes.
Please do. And there's also a 1-800 number to call in case you can't get me. I'm going to throw that in the chat right now also. And thank you for giving me the time to add this on. Okay, the 1-800 number in case I start to drown is going up right now. But do emphasize, please, this isn't just a free-for-all in the most respectful way that I can say that. We do need people who are at high risk of exposure.
And I'm going to read out that.
Otherwise, we can't prove it's effective.
Great. And I'm reading out that 1-800 number, 1-800-804-9140.
That goes to the whole study team who may have access to being able to pick up that hotline.
Great. Thank you so much. This is exactly what new business is all about. Thank you so very much for sharing that.
Thanks, everybody, for your interest.
So we have a second motion to adjourn. Anybody oppose? All right. We stand adjourned. Happy New Year's, everybody. Welcome back.